Anaesthetist we have on the Facebook. The Anaesthetist is now registered as a society in Delhi, in India basically. This is a registered society. Been running this group for the last 3 years. The group was started by Dr. Vivek Gupta. And if you actually need to be part of this group, you can actually send a request to join the group. But what normally happens is that if you do not have anything on your profile that tells you that you are an anesthetist, then Dr. Gupta may not likely approve your journey. Because I know it's not very right to actually go through somebody's profile. So if you actually are not like just somebody, some of these guys that come to me and say, oh, they requested to join the group, but they were not approved. That may be because their profile did not say anything about them, who they are. Some people don't even put photographs who they are, and that's why they may not have been approved. So if that happens, best thing is that you can actually either send Dr. Gupta a message and say that can you please let us join, and you tell us briefly about yourself or to me. But since if you're not my friend, okay, you can send me a friend request or to Dr. Gupta. Because when you send a message, it goes to call others or other messages. Okay, it doesn't go to your main messages. So sometimes if you don't see the message and go through them, then you may not be actually getting an immediate response. Okay. So if you want to join, either you can actually leave a small slip with me, okay, or give your visiting card if you have, and just send a request. I'll make sure that you are able to join the group. With this, we will actually move on to the next thing which we're going to talk about is loss of resistance blocks. Now these are the basic blocks. Now you don't have a nerve stimulator, or you do not, sorry. You don't have ultrasound, you don't have nerve stimulator, but that doesn't mean that you cannot actually give nerve blocks, or you cannot provide any pain relief. Let me just fix this, make sure over here. Yeah, okay, I'll get that. So we're going to talk about loss of resistance block, and each of your booklet would actually, sorry, or your pack would have a booklet, so a lot of the information is there in that. And I had actually written an article, I think it was 2011, it's an open access article on it was called loss of resistance nerve blocks. I was requested to write an article. At that time, it was very fashionable to talk about ultrasound. Well, I thought, how many people actually have access to ultrasound? And even those people who are, especially even in UK, those people who have access to ultrasound, a lot of them still don't use it. There's still like a lot of people I know who actually still go and use peripheral nerve stimulation. And some are still even scared of using the nerve stimulation, and they still rely on morphine or fentanyl or whatever opioids they have. But by using these simple blocks, you can actually reduce the requirement for opioids markedly. In my orthopedics practice, I have not used opioids for the last 12 years. If I use nerve blocks, I don't even use morphine, don't use fentanyl. Okay, we can get away with opioids at all. And we do very complex work. We do limb reconstruction work. Like these patients come with, surgeries being done wrong, they have the metal work taken out, bones chopped off, and a cage put in, laser frames kind of thing, and Taylor special frames and whatnot. These patients actually don't get catheters, they don't get opioids, and they are fine with nerve blocks. So if you can do nerve blocks, you can actually get away with a lot of things. And patients are happy, they are walking the next day. Okay. So looking at the needle blocks, the first thing we need to know is about needles, what kind of needles we can use. We need to know something about cushion effect. This is something which is very, very important. This again we described long back in one of our articles. Okay, obviously it wasn't labeled as the cushion effect. It was actually describing a new technique for ilioinguinal nerve block. And there we had mentioned about use of what is cushion effect. And then obviously we discussed some of the blocks. There are commercially available loss of resistance needle. And unlike your normal hypodermic needle, which is actually very sharp, these needles are short beveled. So if you look at the thing, they are a short bevel, unlike the sharp. Okay, so you don't pierce the skin as you go. Okay, if you do that, you would require high resistance. You can obviously use some of the needles which are available to us. You can actually use spinal needles with introducers to use something called needle through needle technique, or you can actually use a simple needle you have. Just a hypodermic needle. Obviously, for doing deeper blocks, it might be difficult. And for simple blocks, you can use it for ilioinguinal blocks, for fascial block, loss of resistance block for the cervical plexus I was describing. These needles can be used. So how do you actually convert a short bevel needle to a short bevel needle? Okay, the technique is very simple. This actually gives you a lot more control. There are different ways. You can actually, like I was showing an ampule, you take the ampule and you scratch it from inside. Keep scratching it till you actually get the tip actually bending. But this is actually a very easy technique. So what you take a bigger needle, put the sharp end through that and you just bend it. And the more you see, you actually see the beaking, okay? This we call parrot beaking. This is shown from the other side. So the beaking should be towards the opening of the needle, okay, towards the heart. And this is on myself. Okay, you can see how much indentation I'm actually providing. Okay, if I actually used a hypodermic needle, it would have gone through my skin. Okay, this is on my hand. Okay, you can see that. Can you see the indentation? Okay, this is a hypodermic needle which has been blunted. Okay, it doesn't go through the skin, doesn't break that easily. So you can make it yourself. I think this is showing the same thing. So you just need is a green needle. We like to use 21G, okay, good size needle, not too small. Okay, and a bigger needle. These are called drawing of needles. Okay, if you have them, that's fine, but you can use, like, if you get say, use a blue needle through a green needle. Okay, and you can do this characterization. Okay, so what is cushion effect? Anybody who knows about cushion effect? Okay, so we'll put a cushion on the head, what happens? This is one of the problems you face with blunt tip needles. Okay, blunt tip needles actually give you a nice pop, but also they cause the cushioning effect. Okay, this is what this cushioning effect is. Okay. What's happening now is that you are actually approximating the tissue. Okay, you're having to apply a high force. When you apply a high force, you actually bring tissue. So the skin has actually come in close proximity to the fascia. So when you actually break through the skin, you've already gone through the fascia as well. And then say, oh, I wanted to feel 2 pops. Okay, so you try to feel the pop. Okay, you think, okay, you have only gone through the skin. You actually pop here, and deposit local anesthetic in the wrong place. And you say, I got 2 beautiful pops, but I got no effect. It didn't work. Okay, so that's what happens. This is where the cushion effect comes from. When your head hits the pillow, okay, it gets squashed. Obviously, it will depend on the quality of the pillow, where did you buy it from, what it contains. But you will get a cushion effect, whatever it is. Okay, so whether you're thick skin or thin skin or perfect skin, doesn't matter. You will get a cushion effect. And this is what I was talking about. So you actually have the needle. So how you obliterate this cushion effect? You get away from this. How you prevent this? So one of the techniques is to use needle through needle technique. Right? So you use a spinal needle. Spinal needle, especially if it is a bullet pointed or pencil pointed, are good. Obviously, it won't work with quinky. Quinkies are actually like hypodermic needles. But the introducers are sharp needles, so you introduce it through the skin. Don't put it too deep, just through the skin. And then you actually go through that. Okay, you go. So you will feel it pop. You go on the fascia, first fascia. Okay, straight onto the fascia. You'll feel a resistance. You do a bounce. Okay, we'll show you tomorrow. Okay, how to feel it bounce. So you feel it bounce on it and feel it pop. Always feel it bounce. Okay, and then